been estimated that 15% of hospital admissions from the emergency room could be avoided if the emergency room doctors knew all the information about the patient from wherever they came from. Similarly, as patients are discharged from the hospital, there are almost 3 million preventable adverse events that occur to patients every single year around the country as a result of a fumbled handoff. As the hospital is sending someone back to a nursing home or back to the primary care physician, not all the information is properly conveyed, and so patients end up having adverse events happen to them or even hospital readmissions. What the IMPACT project is trying to do is to improve the information flow as patients are transferred from the hospital to the post-acute care settings and from the post-acute care settings back to the hospital to make sure that the right information is there at the right time. There's been a lot of excitement, not just in central Massachusetts, but throughout the state and to some degree throughout the country in the work that's going on with the IMPACT project. We've clearly hit a spot that is a sore spot everywhere. Everyone's recognizing that really there's been a huge piece of the continuum of healthcare that's been left out. In order to be successful in a health information exchange, you really have to address three key pillars, which all successful health information exchanges stand on. You have to first develop trust of all the stakeholders that are involved. You have to show value to each of the stakeholders. They have to recognize that there's benefits that outweighs the work or cost for their participation. And then lastly, it has to be usable. In other words, that whatever you set up, it has to fit into real-world workflows. I think what will happen over time as the standards for communication and the standards for vocabulary truly gel and are finalized, that we'll actually get to a point where there really will be a plug-and-play environment, that in the healthcare system you actually will be able to purchase an electronic health record and plug it into the health information exchange and be able to transfer information without spending tens of thousands of dollars on mapping and interfaces. So I'm hopeful that 5 years from now we're going to look back and say, oh my God, I can't believe that what people had to go through back then.